We're delighted to be joined by America's top medical and public health professionals as we announce historic steps to confront the crisis of autism. Horrible, horrible crisis. I want to thank the man who brought this issue to the forefront of American politics along with me. And we actually met in my office, is it like 20 years ago, Bobby? It's probably 20 years ago in New York. I was a developer, as you probably heard, and I always had very strong feelings about autism and how it happened and where it came from. And he and I don't know, the word got out, and I wouldn't say that people were very understanding of where we were, but it's turning out that we understood a lot more than a lot of people who studied it, we think. And I say we think because I don't think they were really letting the public know what they knew. Thanks as well to the director of the National Institute of Health, Dr. Jay Bhattacharya, FDA Commissioner, Dr. Marty McCary. These are great people. Administrator of the Centers for Medicine and Medicaid Services, Dr. Mehmet Oz, and Acting Assistant Secretary of HHS, Dr. Dorothy Fink. So thank you all. Thank you, Dorothy, very much. The meteoric rise in autism is among the most alarming public health developments in history. There's never been anything like this. Just a few decades ago, 1 in 10,000 children had autism. So that's not a long time. And I've always heard, you know, they say a few, but I think it's a lot less time than that. It used to be 1 in 20,000, then 1 in 10,000. And I would say that's probably 18 years ago. And now it's 1 in 31, but in some areas it's much worse than that, if you can believe it, 1 in 31. And I gave numbers yesterday. For boys, it's 1 in 12. I was told that's in California where they have for some reason, a more severe problem. But whether it's 1 in 12 or 1 in 31, can you imagine? That's down from 1 in 20,000, then 1 in 10,000. And now we're at the level of 1 in 12 in some cases for boys, 1 in 31 overall. So since 2000, autism rates have surged by much more than 400%. Instead of attacking those who ask questions, everyone should be grateful for those who are trying to get the answers to this complex situation. And the first day all of these great doctors behind me were there, I told them this is what we have to find out. Because when you go from 20,000 to 10,000 and then you go to 12, you know there's something artificial. They're taking something. And by the way, I think I can say that there are certain groups of people that don't take vaccines and don't take any pills that have no autism. Does that tell you something? That's currently, is that a correct statement, by the way?
There are some studies that suggest that, yeah, with the Amish, for example.
The Amish, yeah, virtually. I heard none. See, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with what I say. But you have certain groups. The Amish, as an example, they have essentially no autism. First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol during pregnancy, can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's, for instance, in cases of extremely high fever, that you feel you can't tough it out, you can't do it. I guess there's that. It's a small number of cases, I think. But if you can't tough it out, if you can't do it, that's what you're going to have to do. You'll take a Tylenol, but it'll be very sparingly. It can be something that's very dangerous to the woman's health. In other words, a fever that's very, very dangerous, and ideally a doctor's decision, because I think you shouldn't take it. And you shouldn't take it during the entire pregnancy. They may tell you that toward the end of the pregnancy, you shouldn't take it during the entire. And you shouldn't give the child a Tylenol every time he's born and he goes and has a shot. You shouldn't give a Tylenol to that child. All pregnant women should talk to their doctors for more information about limiting the use of this medication while pregnant. So ideally, you don't take it at all, but if you can't tough it out, if there's a problem, you're going to end up doing it. The other thing that I can tell you that I'll say that they will maybe say at a little bit later date, but I think when you go for the shot, you do it over a 5-time period. Take it over 5 times or 4 times, but you take it in smaller doses and you spread it out over a period of years. And they pump so much stuff into those beautiful little babies. It's a disgrace. I don't see it. I think it's very bad. They're pumping, it looks like they're pumping into a horse. You have a little child, little fragile child, and you get a vat of 80 different vaccines, I guess, 80 different blends, and they pump it in. So ideally, a woman won't take Tylenol. And on the vaccines, it would be good instead of one visit where they pump the baby, load it up with stuff, you'll do it over a period of 4 times or 5 times. I've been so into this issue for so many years just because I couldn't understand how a thing like this could happen. And it's artificially induced. It's not like something that when you go from all of those, healthy babies to a point where I don't even know structurally if a country can afford it. And that's the least of the problems. To have families destroyed over this is just so terrible. I also, and we've already done this, we want no mercury in the vaccine. We want no aluminum in the vaccine. The MMR, I think, should be taken separately. This is based on what I feel, the mumps, measles, and all the 3 should be taken separately. And it seems to be that when you mix them, there could be a problem. So there's no downside in taking them separately. In fact, they think it's better, so let it be separate. The chicken pox is already separate because when that got mixed in, I guess they made it 4 for a while, it really was bad. So they make chicken pox. Individually, they're
all right, we're going to continue to listen in to the president's announcement here, but we do want to fact check a little bit of some of the claims that he is making here about vaccines and medications that are taken during pregnancy. With me now, health and medical reporter Erica Edwards. Erica, what most stands out to you here in some of the things the president has said in the initial part of his remarks?
I don't know where to start. So many things. One are his numbers that he's coming up with. We've already known that in the year 2000, 25 years ago, it was just 1 in 150 children. The American Academy of Obstetricians and Gynecologists all say that Tylenol is the safest drug to take during pregnancy. We already know that 65% of women, when they're pregnant, take this drug at some point or another. We know that fevers during pregnancy can actually be harmful to both mom and baby. It can lead to dehydration and other issues. So that's why doctors recommend bringing those fevers down. He's now going on about vaccines, separating MMR. There is no indication whatsoever that separating those shots, it's just not even possible, right? Like the MMR vaccine has been in existence for decades. It's very safe. It's very effective. What I think that he's probably referring to is last week, CDC's Vaccine Advisory Committee was looking into a combination MMR and varicella chickenpox vaccine. They decided that babies as young as 1 year old should not have that combination shot because it can, in very rare circumstances, lead to a febrile seizure, which is obviously very scary for parents to watch. It lasts, a couple of minutes maybe, but it does no long-term damage. The point is that vaccine committee has already sort of known that that can happen in age 1, but has nothing to do with what we're talking about right now, which is autism.
Okay. All right, Erica, continue to listen in. We're going to go back to what the president is saying, but if he says something you think we need to check, just let us know. Back to the president.
And if you can't live, if your fever is so bad, you have to take one because there's no alternative to that. Sadly, first question, what can you take instead? It's actually, there's not an alternative to that. And as you know, other of the medicines are absolutely proven bad. I mean, they've been proven bad with the aspirins and the Advils and others, right? And they've been proven bad. So I'd like to ask Bobby to get up to the podium and say a few words, and then Dr. Bhattacharya and Dr. McCary, Dr. Oz, Dr. Fink, followed by two incredible mothers that have experienced firsthand what this country is going through, what parts of the world are going through. And I will say there are parts of the world that don't take Tylenol. I mean, there's a rumor, and I don't know if it's so or not, that Cuba, they don't have Tylenol because they don't have the money for Tylenol, and they have virtually no autism, okay? Tell me about that one. And there are other parts of the world where they don't have Tylenol, where they don't have autism. That tells you a lot. And I want to say it right now. And, the way I look at it, don't take it. Don't take it. There's no downside in not taking it. So I'd like to ask Bobby to come up and say a few words. I hope I didn't ruin his day, but that's the way I feel. I've been very strong on the subject for a long time. Life is common sense, too. And there's a lot of common sense in this, and I wish things like this were brought up, and this group has worked so hard on it. But I'd like to be a little bit more, a little speedier in the process of a recommendation, because there's no harm in going quicker. There's absolutely no harm. At worst, there's no harm. Thank you very much. Bobby, please.
Thank you, Mr. President. To meet the president's challenge, I ordered HHS to launch an unprecedented all-agency effort to identify all causes of autism, including toxic and pharmaceutical exposures. At President Trump's urging, NIH, FDA, CDC, and CMS are turning over every stone to identify the etiology of the autism epidemic and how patients and parents can prevent and reverse this alarming trend. We have broken down the traditional silos that have long separated these agencies, and we have fast-tracked research and guidance. Historically, NIH has focused almost solely on politically safe and entirely fruitless research about the genetic drivers of autism. And that would be like studying the genetic drivers of lung cancer without looking at cigarettes. And that's what NIH has been doing for 20 years. As a result, we don't have an answer to this critical question, despite the cataclysmic impact of the epidemic on our nation's children. We are now replacing the institutional culture of politicized science and corruption with evidence-based medicine. NIH research teams are currently testing multiple hypotheses with no area off limits. We promise transparency as we uncover the potential causes and treatments, and we will notify the public regularly of our progress. Today, we are announcing two important findings from our autism work that are vital for parents to know as they make these decisions. First, HHS will act on acetaminophen. The FDA is responding to clinical and laboratory studies that suggest a potential association between acetaminophen use during pregnancy and adverse neurodevelopmental outcomes, including later diagnosis for ADHD and autism. Scientists have proposed biological mechanisms linking prenatal acetaminophen exposure to altered brain development. We have also evaluated the contrary studies that show no association. Today, the FDA will issue a physician's notice about the risk of acetaminophen during pregnancy and begin the process to initiate a safety label change. HHS will launch a nationwide public service campaign to inform families and protect public health. FDA also recognized that acetaminophen is often the only tool for fevers and pain in pregnancy. as other alternatives have well-documented adverse effects. HHS wants, therefore, to encourage clinicians to exercise their best judgment in the use of acetaminophen for fevers and pain in pregnancy by prescribing the lowest effective dose for the shortest necessary duration and only when treatment is required. Furthermore, thanks to the politicization of science, the safety of acetaminophen against the risk of neurodevelopmental disorders in young children has never been validated. Prudent medicine, therefore, suggests caution in acetaminophen use by young children, especially since strong evidence also has associated it with liver toxicity. Some studies have also found the use of acetaminophen in children can potentially prolong viral illnesses. FDA will drive new research to safeguard mothers, children, and families. In addition to a possible acetaminophen connection to autism for pregnant women, infants, and toddlers, our research has revealed that folate deficiency in a child's brain can lead to autism. We have also identified an exciting therapy that may benefit large numbers of children who suffer from autism. Peer-reviewed literature has documented that up to 60% of folate-deficient children with ASD can have improved verbal communications if given leucovorin. I have instructed NIH, FDA, and CMS to help doctors treat children appropriately. Jay will help tell that story, which started with sound science, the kind that restores faith in government. This announcement also represents a historic collaboration between NIH, FDA, CDC, and CMS. We expect this to be the first of many announcements over the coming years that deliver actionable information to parents on underlying cause of autism and the potential paths for prevention and reversal. Finally, autism is a complex disorder with multifactorial etiology. We are continuing to investigate a multiplicity of potential causes with no areas of taboo. One area that we are closely examining, as the president mentioned, is vaccines. Some 40 to 70% of mothers who have children with autism believe that their child was injured by a vaccine. President Trump believes that we should be listening to these mothers instead of gaslighting and marginalizing them like prior administrations. Some of our friends like to say that we should believe all women. Some of these same people have been silencing and demonizing these mothers for 3 decades because research on the potential link between autism and vaccines has been actively suppressed in the past. It will take time for an honest look at this topic by scientists. But I want to reassure the people in the autism community that we will be uncompromising and relentless in our search for answers. We will perform the studies that should have been performed 25 years ago. Whatever the answer is, we will tell you what we find. We are researching this issue to all 3 agencies. Jay will discuss one of our research initiatives at NIH. This model of unleashing unbiased, depoliticized, gold standard scientific research and academic freedom to deliver actionable information to prevent and reverse disease will be a model for the framework to deliver similar results for many other chronic conditions that plague Americans. Jay?
Thank you, Secretary Kennedy, and thank you, President Trump.
Thank you very much.
I'm proud to announce today that the NIH has launched the Autism Data Science Initiative to turbocharge autism research, devoting an additional $50 million to the cause of studying autism. Nearly 250 research teams from across the country applied, sent in their applications, and were peer-reviewed by the NIH review panels. The NIH peer reviewers chose the 13 best projects focused on root causes and therapies, with replication and validation studies to guarantee gold standard science. The studies feature a new kind of science called exposomics, where scientists consider environmental and medical factors, nutrition, events during pregnancy, in combination with biology and genetics to answer vital questions about autism. Science like this, conducted in partnership with families and physicians, is the best way to arrest and reverse the autism epidemic. Autism spectrum disorder encompasses a very wide range of symptoms, ranging from mild difficulties with social interactions to profoundly autistic children who experience severe disabilities in speech and behavior. Given this wide range of symptoms across the spectrum, it seems certain that there will be a wide range of biological contributors to explaining the cause. The great thing about the new NIH initiative on autism is that scientists will use rigorous advanced methods in causal inference, machine learning, organoids, and other fresh approaches to the problem. The sharp rise in the prevalence of autism deserves an urgent response by the scientific community. As Bobby said, the NIH has invested a lot of money to study autism over the years, but the research has not produced the answers that families and parents of autistic children deserve, and autistic children themselves deserve. For too long, it's been taboo to ask some questions for fear the scientific work might reveal a politically incorrect answer. Because of this restricted focus in scientific investigations, the answers for families have been similarly restricted, often pointing families to behavioral therapies that don't work for every kid or suggest non-modifiable genetic factors as the cause. But genetics alone can't explain such a sharp rise in autism prevalence over just a few decades, as the president said. In coming months and years, as NIH scientists learn more that can help autistic children and their families, we won't delay. Like scientists often like to do, I can say as a scientist myself, it's really tempting to delay, but in face of a problem like this, you have to move fast. But we will not delay before telling American people about what we find, and we will win the public trust with transparency and rigor. Already, our broadened focus on autism research has pointed to 2 items that will help families prevent and treat some cases of autism. I'll leave the good news on these 2 items to my close friends and colleagues, Dr. McCary and Dr. Oz. We've been working together closely on this problem for the past 6 months, and our cooperation represents an unprecedented collaboration with Secretary Kennedy's Department of Health and Human Services and with President Trump. I'm delighted to introduce Dr. Marty McCary, Commissioner of the Food and Drug Administration, who will tell you about these announcements of practical help for families with autism.
Great, thank you, Dr. Bhattacharya. Mr. President, this is the start of a historic shift in medical culture. This administration is working together to ask big questions about why our nation's children are getting sick so fast. Too often, medicine is doing small little studies, giving us answers we already knew. But we've got to make a difference. You've given us a charge to identify root causes, and we are not going to stop so that we can end the suffering we are watching. And if you've seen a kid with autism, with severe autism, it's hard to watch. Kids get frustrated, they get angry, they can be crying because they want to speak and they can't speak. It's hard to watch, and it may be entirely preventable. For an epidemiologist, that child is an expanding statistic. But for a child, it can be brutal to have autism. Today, the FDA is taking action to update the label on acetaminophen and sending a letter to all U.S. doctors letting them know about the risks in pregnancy. We now have data we cannot ignore. There's a very large study, the Boston Birth Cohort, with researchers that have, from Johns Hopkins, my former institution, and Boston University, found quote-unquote consistent associations between acetaminophen in pregnancy and autism. And the Nurses' Health Study with researchers from Yale, Columbia, and Harvard looking at 9,000 kids found that acetaminophen use in pregnancy was associated with neurodevelopmental disorders. And 4 weeks ago, a Mount Sinai Harvard study reviewed all the existing literature and found the overwhelming body of evidence points to an association. Sure, you'll be able to find a study to the contrary. That's how science works. But to quote the dean of the Harvard School of Public Health, there is a causal relationship between prenatal acetaminophen use and neurodevelopmental disorders of ADHD and autism spectrum disorder. We cannot wait any longer. And honestly, there's been this perfunctory, reactionary, mindless practice in medicine. I learned it in medical school and residency. Just treat all fevers, low-grade fevers, treat them with acetaminophen. Why? What are we doing? A study out of Hopkins actually showed that treating a fever can prolong the duration of illness in a young kid. Maybe that's because
you have been listening to this event, of course, at the White House with President Trump. That big announcement on this new warning on a key ingredient found in pain relievers like Tylenol, linking it to autism. Although there are questions about the science behind some of these recent studies, causation versus correlation, et cetera. Scientists have been looking at this potential link between autism and acetaminophen for years, but the data, according to experts, has been fairly inconclusive at best. And major medical groups say acetaminophen is one of the only safe pain relievers for women during pregnancy. We're going to come back into this event once the president, if he does, starts to take questions or speaks again. So we'll leave it up there. But I want to bring in, as we've got team coverage here, our medical correspondent, Erica Edwards. Dr. Kavita Patel is also with us, as is Vaughn Hilliard. Erica Edwards, let me start with you here, because you heard the president in extraordinarily clear terms say, don't use Tylenol, as he said, Tylenol. Again, being clear, we're talking about acetaminophen here. Give us a context check on some of this, because there are some questions regarding what the president and his health secretary are putting forward.
You know, this was an extraordinary announcement, mainly because of the misinformation that I heard from our president. Starting with the numbers of autism cases in the U.S., he was claiming that it was 1 in, I don't know, whatever, 1,000 just 20 years ago. Let's put it this way. In 2000, there was 1 in 150 kids with autism in this country. In 2016, it was 1 in 54. Now it's 1 in 31. And experts who have been studying autism for decades say that there's nothing new going on biologically, but it's because we have increased awareness and that we have expanded the definition of autism spectrum disorder overall. As many as 65% of pregnant women take Tylenol sometime in their pregnancy. And so, you know, the doctors I've talked with said that there's absolutely no evidence that linking acetaminophen with autism. In fact, there was a huge study last year published looking at kids with autism and their siblings, right? They have similar genetics, they have similar, you know, environmental exposures. There was no link with that major study. Hallie.
There's another question, too, related to, you know, why pregnant women would be taking acetaminophen in the first place if they have, for example, a fever. We know that some of these expert groups, these medical organizations have said that can actually be very dangerous for pregnant women, too.
Because fevers indicate infection, right? So if you have a fever, you take Tylenol to get rid of that, or to sort of bring down your body temperature. Fevers in utero have been linked to dehydration in the developing babies, and that could itself cause problems.
I want to come to Dr. Kavita Patel here, who's been listening along with us. One of the things that Erica referenced too, the idea that we have a better understanding of autism spectrum disorder, that there is more awareness of it, is why this comparison that the president made to Cuba is one that experts question as well. This idea that Cuba has lower rates of autism because they don't use as much acetaminophen.
Right. We know also that the rates of autism have not necessarily been this massive shift just because of all this causality, which, by the way, even these studies between Tylenol were not done in a way where you could demonstrate that causal link.
Pause there. Can you explain that difference? Because that's super, super important.
All right, so let's take the Harvard study that you just heard about. That was actually what we call a systematic review it's a review of other studies. They included 46 studies, 100,000 people, lots of people, but it was a lot of different studies that were done for different purposes. And then they just retrospectively kind of looked and tried to see if there was any association. So I'll give you the analogy. They may have found that people who took Tylenol had children that had some sort of autism spectrum disorder, but they never necessarily also teased out if they had access to prenatal care, if they also had other things that could have contributed to that diagnosis of ASD. So I think to distill it all to some one thing cause the other is actually not reading the study the way that Harvard intended for it to be done.
We've also heard now the administration and these top health officials, as we're listening, obviously keeping an ear on this, wanting to make sure that we're getting the context checks in too, talk about offering folate and the prevalence of folate here to people who do have autism.
Right, and there's been so much that's been talked about, and we're still kind of hearing it unfold. But there has been a leak, and already now we're seeing the demonstration of this kind of link with a potential treatment for autism spectrum disorder. You heard FDA, NIH, CMS, and now the secretary saying that, well, we have this potential that could be a treatment for autism spectrum disorder. Let me be clear. Those studies have been small. They're promising. And I think what it does is it misaligns that we know that autism spectrum disorder is not one thing and there's not one manifestation. So is there a potential for leucovorin, which is basically a more active form of folate, which is a basic element that we should have in our leafy greens and vegetables? There has been studies that have shown that potentially the uptake of folic acid into the brain is one of many reasons that we can see a representation of autism in children. So I think that it's a very important set of studies to do, but one could argue, and I would, that we have so many other things that we could link and also explore. And so I'm very interested in what the NIH is standing up to understand, are there other studies being done?
Right.
And then I would love to kind of make sure that what I'm worried about right now is that if I'm a mother with a child with autism,
right.
I want to call and get on this medication. It's an oral pill given sometimes in 2 doses a day. Why can't I get it? Well, because we just don't know if that will actually help. And we don't want to give anything that could potentially harm or mislead people from a potential treatment that we don't even have for autism spectrum disorder today.
What if, Erica Edwards, let me go back to you and then we'll get to Von Hilliard, but Erica, if you are a woman who is pregnant right now and you're watching this and you're going, well, wait a second, what am I supposed to do if I catch a cold, if I get a fever, et cetera? The advice is always, of course, talk to your doctor, talk to your personal doctor who knows you and who knows your personal health. But I wonder what you've heard from experts as you've been reporting this out over the last couple of weeks.
Yeah, here's the deal. I mean, whether this checks out over time, the damage has been done. Women who are pregnant or are considering getting pregnant are now fearful of Tylenol. They're fearful of acetaminophen. And so that's what folks who I'm hearing from are most concerned about. And so, yes, of course, as you said, talk to your doctor. But yeah, I mean, the fear is already there. President Trump mentioned vaccines. That's also been debunked time and time again. But the fact that, the president of the United States has come out on this national platform to talk about these things is really major, right? And it's something that scientists, doctors have already sort of looked into. And my big question is, why now? Why today is this coming out? Because the doctors I've talked with said there's really no new research that we haven't heard about before that's leading to this particular announcement today, other than the fact that the secretary announced that, earlier this year that he would have some sort of answer by September.
I want to explain to you what we're hearing from Kenvue, which is the maker of Tylenol. Again, we're talking more generally about acetaminophen, at least the health secretary is, although you heard the president very directly point to Tylenol here. And Kenvue says that we believe independent sound science clearly shows that taking acetaminophen does not cause autism. They go on to say, we strongly disagree with any suggestion otherwise and are deeply concerned with the health risk this poses for expecting mothers. They say, Dr. Patel, it's the safest pain reliever option for pregnant women as needed. And without it, and this is what I think is what Erica was speaking to too, without it, women face dangerous choices, suffer through conditions like fever that are potentially harmful to both mom and baby, or do something else, use an alternative that could potentially be riskier.
Right, or pain. I mean, a lot of what we do is I've got patients who are pregnant with migraines, with headaches, with back pain, all sorts of things. And just weighing the risk and the benefit of acetaminophen for that mother in that situation is exactly what we do. By the way, we don't just say take as much acetaminophen as you want. We actually have, and the standards for the American College of Obstetrics and Gynecology, the American Medical Association, every single major association has said, use it in a sparing way to weigh the benefit and risks, but not because we see this causal link, but just because we tell that to pregnant women about almost everything.
That's right.
I tell women to avoid non-steroidal anti-inflammatory drugs because of some risks potentially to the fetus. I tell women to avoid soft cheese because there might be a bacterial infection. We avoid alcohol and tobacco. That's exactly right. So we put this in line with where we see risk and benefit. And this is Tylenol, acetaminophen, is one of the safest things we can give.
But now, Von Hilliard, you have the levers of government that are behind this move, from Secretary Kennedy, who noted and longtime vaccine skeptic here, from President Trump as well, as they're suggesting now. Secretary Kennedy says that the FDA is going to initiate the process on the safety label change for acetaminophen here. And some of the language here, I think, is absolutely worth noting, because you heard Secretary Kennedy invoke the phrase, believe all women. which had long been used as a phrase since really the Me Too movement for sexual assault victims and survivors. And his suggestion is that you've also got to believe women, mothers, who have children with autism as well. The language around this, obviously political and health announcement, is, I think, worth talking about.
Absolutely. And when you're looking at the two men's relationship, there were a lot of questions that people were speculating whether Secretary Kennedy would be pushed out the door in the past weeks over the firing of the 17 members of the advisory committee on vaccines. And yet we have not heard publicly any reason from the president to question the actions of Secretary Kennedy. And, you know, I was out on the campaign trail with the two men in 2024, and then candidate Trump made very specifically that he was going to let Kennedy, quote, go wild on vaccines and anything else he wanted to go. And so in large part, this moment here at the White House is affirmation from the President of the United States to the decades-old work that Secretary Kennedy has taken on. And I think that that is where, even in this moment here, you heard the president use, you know, sort of playing almost doctor role there in a way that it's hard not to take you back to 2020 during the COVID response to the recommendations that he was providing that typically would come from medical professionals. But the president himself said, quote, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with what I say. And he says taking Tylenol is not good. Don't take it. There's no downside in not taking it. Now, we should be clear. Just minutes later, Secretary Kennedy came out and did, as you guys just outlined, provide the scenarios and reasons why taking Tylenol has long benefited women during pregnancy here. And so I think this is a relationship between the two men. You know, the president suggested that they first met 20 years ago on this. I was at Trump Tower back in 2016 after President Trump won his first race, in which he welcomed Kennedy up to the Oval, or up to Trump Tower. And there were a lot of questions about where these two men's relationship would go. And ultimately, President Trump backing the efforts of Secretary Kennedy here in real time.
Vaughn Hilliard, thank you very much for that. We're going to continue to listen in to this event at the White House. Dr. Kavita Patel, Vaughn Hilliard, Erica Edwards. We're going to keep you close as the president is speaking again. Let's actually go in and listen in case he does take a couple of questions here, just for a brief moment.
The term is used throughout this conference. So it's essentially Tylenol. And I just recommend strongly that you don't use Tylenol unless it's absolutely necessary. I understand it's maybe 10% of the women that are pregnant are, would perhaps be forced to use it.
Just worth noting here, again, medical advice from President Trump, who is obviously not a doctor, Robert F. Kennedy Jr. behind him, the health secretary. We're going to continue to listen to this in case the president does take a couple of questions. Let's listen for one more second.
Stronger from me than from the group because they're waiting for certain studies. I just want to say, it like it is. Don't take Tylenol. Don't take it. If you just can't, it's just fight like hell not to take it. There may be a point where you have to, and that you have to work out with yourself. So don't take Tylenol. Other things that we recommend, or certainly I do anyway, is, and it's so important to me to see the doctor 4 times or 5 times for a vaccine. Don't let them pump your baby up with the largest pile of stuff you've ever seen in your life going into the delicate little body of a baby. Even if it's 2 years, 3 years, 4 years, you just break it up into, I would say 5, but let's say 4 visits to the doctor instead of 1. And certain things I think you should do. We've already taken out and are in the process of taking out mercury and aluminum now. You know what mercury is. You know what aluminum is. Who the hell wants that?
President Trump here, again, the manifestation of his health secretary's longtime vaccine skepticism. You're hearing some of the president's. He is just delivering advice to pregnant women who will listen. Dr. Kavita Patel, notable to you what the president's suggesting here.
I mean, I think it's kind of stunning because he even acknowledged that his own advisor standing behind him
would not go as far as
he would. So to say pregnant women should not take Tylenol, period, full stop, is pretty unusual. And then to link that somehow to vaccine schedules, as well as linking that to autism. If you can imagine, not just a pregnant woman, but even somebody who's thinking about what they did during their pregnancy is sitting there right now listening to this and thinking, what do I make out of it? And it's very hard when someone with no medical background is kind of offering unfortunately, medical advice.
And again, we're talking about acetaminophen, which is in Tylenol, and the makers of Tylenol, just to reiterate here, listing have provided a slew of other studies that they say back up their assertion that they believe that sound science shows that taking acetaminophen does not cause autism. We're going to continue to monitor this. We've also got to get to some other late-breaking news today. You may have heard about it. It's a big deal because Disney says Jimmy Kimmel is going to be back on Late Night tomorrow after the show was pulled off the air last week because of what Kimmel said around the death, the assassination of Charlie Kirk. Disney today says we've spent the last days having thoughtful conversations with Jimmy, and after those conversations, we reached the decision to return the show on Tuesday. So tomorrow night, Late Night, Kimmel, presumably, you got to think he's going to talk about this whole thing. And all of it as Disney has faced this building boycott. People online, you've probably seen it, saying things like they're going to cancel their Disney Plus, their Hulu.
Now, Tylenol is fine for people that aren't pregnant, that aren't in a situation that we're talking about. One very specific situation. If you're pregnant, don't take Tylenol. When you have your baby, don't give your baby Tylenol at all, unless it's absolutely necessary.